ಟೈಮಲ್ಲಿ ಇದೆರಡು ಡಿಸ್ಪ್ಲೇ ಮಾಡು ಸಾಕು. ಯಾ, ಇದು ಫಸ್ಟ್ ತೋರಿಸು. ಈ 6:40ಗೆ ಇವ್ರದ್ದು ಮುಗಿಯುತ್ತೆ ಸುಬ್ರಹ್ಮಣ್ಯ ಸರ್ದು. ಆವಾಗ ಈ ಎರಡು ತೋರಿಸು, ಒನ್ ಆಫ್ಟರ್ ದ ಅದರ್ ತೋರಿಸ್ತಾನೆ ಇರು 5 ನಿಮಿಷ.
Okay, sir.
6:45 will start with the second one.
Okay, sir.
Okay.
Dr. Ravi has joined. He has to give the invocation.
He spoke to him in the night actually. He said he'll join, ma'am. He said he'll do.
I don't think it will do. Maybe I'll just send
ಒಂದ್ಸರಿ ಫೋನ್ ಮಾಡ್ಬಿಡಿ ಮೇಡಮ್ ಅವ್ರಿಗೆ.
reminder task.
ನಿಶಾಂತ್.
Yes, sir.
ನಿಮ್ಮ ಹುಡುಗ ಶಶಾಂಕ್ ನನ್ಗೆ ಹೆಲ್ಪ್ ಮಾಡ್ತಾ ಇದ್ದಾನೆ ಬಿಡು. We have a quiz team today.
ನಾನು ಬೇರೆ ಸ್ಟ್ರೀಮ್ ಮಾಡಿದ್ದೀನಪ್ಪ, ಅದನ್ನು ಹಾಕಿದ್ದೀನಿ. ಓಕೆ,
ಲೈವ್ ಆನ್ ಯೂಟ್ಯೂಬ್ ಇದೆ ಸರ್ ಆಲ್ರೆಡಿ. ಯಾ, ಐ saw that.
ಬಟ್ ಲಿಂಕ್ ಇಸ್ ಡಿಫರೆಂಟ್, ಪ್ಲೀಸ್ ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್. ಐ ಹ್ಯಾವ್ ಸೆಂಟ್ ಇಟ್ ಟು ಆಲ್ ದಿ ಪೀಪಲ್.
ನೀವು ಆ ಲಿಂಕ್ ಅದು ಆಮೇಲೆ ಕಳಿಸಿ, ಐ ವಿಲ್ ಶೇರ್ ಇಟ್ ಇನ್ ದ ಗ್ರೂಪ್. ನಾಟ್ ಎ ಪ್ರಾಬ್ಲಮ್ ಸರ್. ಇದು ಮಾಸ್ಟರ್ ಶೀಟ್ ಅಲ್ಲಿ ಇವ್ರದ್ದು ಓಪನ್ ಆಗ್ತಾ ಇಲ್ಲ ಅಲ್ವಾ? ಆಕ್ಚುಲಿ CSCP ಅಜಿತ್ ಹುಲ್ಗೋಳ್ದು ಓಪನ್ ಆಗ್ತಾ ಇದೆಯಾ? ಹೈಪರ್ ಲಿಂಕ್ ಆಗಿದೆಯಾ ಅವ್ರದ್ದು? ಸುಬ್ರಹ್ಮಣಿ, ನೀವು ಡೈರೆಕ್ಟ್ ಪ್ಲೇ ಮಾಡ್ತೀರಲ್ವಾ ಸರ್ ಇವ್ರದ್ದು, ಸುಬ್ರಹ್ಮಣ್ಯ ಸರ್ದು?
ಆಗಿದೆ.
So last Shashank to close the screen.
ಇಲ್ಲ, ಅಜಿತ್ is sharing his screen.
Okay, fine. Okay.
Ask Shashank to close this, stop sharing. Shashank, stop sharing your screen.
Yeah. Shashank, be online. ನಾನು ಹೇಳಿದ್ ಮಾಡ್ಕೊಂಡು ಹೋಗು. Okay? Yeah. Ravishankar sir is there for invocation.
Welcome, Dr. Ravi.
Good evening everybody.
Good evening.
I welcome Shivram sir.
Good evening, Shivram sir.
Sir, congratulations. ಏನಕ್ಕೆ ಅಂತ ಕೇಳಬೇಡಿ ಸರ್, ಅನ್ಮ್ಯೂಟ್ ಮಾಡಿ. Congratulations.
Thank you.
Good evening, sir.
Convey our wishes from SSB to your daughter and son-in-law in advance.
Thank you. I was a little busy. I was logging on and off.
We ಗೊತ್ತಾಯ್ತು ಸರ್, ಗೊತ್ತಾಯ್ತು. ಎನಿವೆ, ಅದಕ್ಕೆ ಅಡ್ವಾನ್ಸ್ ಕಂಗ್ರಾಚುಲೇಷನ್ ಫ್ರಮ್ SSB.
Thank you.
Good evening, sir.
ಒಂದು ಪಾರ್ಟಿ ನಿಮ್ಮ ಕಡೆಯಿಂದನೂ ಪೆಂಡಿಂಗ್ ಇದೆ ಹಂಗಾದ್ರೆ.
The preparations are the same, even if it's virtual wedding.
True. Yeah.
We have Dr. Sharath also. Good evening, Dr. Sharath. He is son of Dr. Hanumaiah. Good evening.
Good evening, madam.
Good evening.
Good evening, Dr. Sharath.
Thank
Sir,
you
good
for
evening, sir.
joining, sir.
Good evening, Sharath. Welcome.
Good evening, sir.
Yeah.
Welcome, Sharath sir.
Thanks for welcoming.
Very nice of you to join. Yeah.
Thank you, sir.
ನನ್ನ ಸ್ಕ್ರೀನ್ ಕಾಣಿಸುತ್ತಲ್ವಾ?
Sure, sir.
ಶಂಕರಪ್ಪನವರು, ಸುಬ್ರಹ್ಮಣ್ಯ ಸರ್ ಇಬ್ರು ಇದನ್ನೇ ಮಾಡ್ತಾರೆ.
Sir,
I will stop sharing right now.
Yeah. Sir, ಸ್ವಲ್ಪ ಟೈಮಿಂಗ್ ಶಂಕರಪ್ಪ ಸರ್ಗೂ ಹೇಳ್ಬಿಡಿ. 5 ನಿಮಿಷ.
ರೆಡಿ ಇದೆ. Everybody is on the dot.
Yeah, very good sir.
No issues.
Yeah.
Okay. So when you
we have 2 more minutes.
Yeah, when you start, I will just screen share and then ನೀವು ಶುರು ಮಾಡ್ಕೊಳ್ಳಿ. President can talk, Ravi can give the invocation. Ahmed Shankarapnavaru, he'll start.
Yeah.
When you ask him to do so.
So we can have 30 seconds feedback from Shashank one, then Sheena from RRMC.
That is in the end, alva?
End, sir. Just before my vote of thanks. Yeah.
Okay.
I'll
citation screen share yaar ಮಾಡ್ತಾರೆ, ಇವರು ಮಾಡ್ತಾನಾ?
Shashank ಮಾಡ್ತಾರೆ.
Shashank will do it.
Yeah.
Okay. So that is at the end of Subramani sir's oration. I will stop sharing at that time.
Then we'll ask Ajit sir to do it. And Manish, we want the Manish to introduce Ajit.
ಇದನ್ನ ನೋಡಿ.
ಮೇಡಮ್ ಒಂದ್ಸರಿ ಮನೀಶ್ಗೆ ಒಂದ್ಸರಿ ಫೋನ್ ಮಾಡಿ, ಆಮೇಲೆ ಇದು ಓಟಿಗೆ ಹೋಗ್ಬಿಟ್ರೆ ಕಷ್ಟ. ಮನೀಶ್,
we have Dr. Jayarajan also, sir. Welcome.
Chairs. ಇದು ನಿಮ್ಮ ಚೇರ್, so that
ma'am, just try to call Manish.
Yeah.
So that
we have Dr. Jayarajan, sir. Welcome, sir, to you. Good evening.
He has to unmute. Jayarajan sir has to unmute.
Jayarajan sir, good evening and welcome, sir. Nice to have you.
Sir, good evening, sir.
Unmute yourself, sir.
Good evening, Kalevani and all others.
Also, good evening.
Adhira sir, namaste sir. Good evening.
Namaste, Venkatesh.
Good evening, sir.
You all seem to be very relaxed, Venkatesh.
Yes, sir. ನೆನ್ನೆನೇ ಮುಗಿದು ಒಂದು 30 ml into 3 times ಆಗೋಯ್ತು ನೈಟ್.
What did Kalevani had? Coconut water or what?
ಇದು ಸರ್ ಏನದು ಇದು ಮಿಲ್ಕ್ ಮಜ್ಜಿಗೆ.
just reminding you.
So, can we start, sir, at 6 o'clock?
Is orators ready?
Yeah, yes, sir. They are ready. Sir, Subramani sir, 15 ದಿವಸದಿಂದ ready ಆಗಿದ್ದಾರೆ. So, good evening all. I welcome all of you, the advisors, the EC members, the Surgical Society members, the postgraduates, the faculty, internal faculty, external faculty. Hope it was successful. ನಾನೇ ಹೇಳ್ಕೊಂಡ್ರೆ ಚೆನ್ನಾಗಿರೋದಿಲ್ಲ. The CSCP went on very well.
It's not hope, Venkatesh, it is fact.
Thank you, sir. Thank you.
Thank you, sir. Thank you.
So I welcome President Ma'am, Dr. Kalaivadi, to chair this session. So for this prestigious orations, Hanumaiah Memorial and the Authikeshavulu. So we can have invocation by Dr. Ravi Shankar.
Thank you, Dr. Venkatesh.
Sir, exactly 1 or 2 minutes, sir. Less than 2 minutes.
No, I was promised more this time. I will.
Yeah, you please.
The chance illa sir, adu party kutkondag ಮಾಡೋಣ.
No, I think we have little time. We'll see.
Okay. Let us start by invoking the blessings of Lord Ganapati. This is a Pancharatna Kriti by Adi Shankaracharya, Ganesha Pancharatna. मुदाकरात्तमोदकं सदा विमुक्तिसाधकं कलादरावतंसकं विलासिलोकरक्षकम् अनायकैकनायकं विनाशिते बदैत्यकं नताशुभाशुनाशकं नमामि तं विनायकम् अनायकैकनायकं विनाशिते वदैत्यकं नताशुभाशुनाशकं नमामि तं विनायकम् नमामि तं विनायकम् न तेतरातिभीकरं नवोदितार्कभास्करं न मत्सुरारिनिर्जरं न तादिकापदुद्धरं सुरेश्वरं निधीश्वरं गजेश्वरं गणेश्वरं महेश्वरं समाश्रये परात्परं निरन्तरं समस्तलोकशङ्करं निरस्तदैत्यकुञ्जरं दरेतरोदरं वरं वरे भवत्रमक्षरं कृपाकरं क्षमाकरं मुदाकरं यशस्करं मनस्करं नमस्कृतां नमस्करोमि भास्करम् अकिञ्चनार्तिमार्जनं चिरन्तनोक्तिभाजनं सुरारिपूर्वनन्दनं पुरारिगर्वचर्वणं प्रपञ्चनाशभीषणं धनञ्जयादिभूषणं कपोलदानवारणं भजे पुराणवारणं भजे पुराणवारणम् नितान्तकान्तदन्तकान्तिमन्तकान्तकात्मजम् अचिन्त्यरूपमन्तहीनमन्तराय कृन्तनं नितान्तकान्तदन्तकान्तिमन्तकान्तकात्मजम् अचिन्त्यरूपमन्तहीनमन्तराय कृन्तनं हृदन्तरे निरन्तरं वसन्तमेव योगिनाम् अनेकदन्तमेवकं विचिन्तयामि सन्ततं महागणेश पञ्चरत्नमादरेण योन्वहं प्रजल्पति प्रभातके हृदि स्मरन् गणेश्वरम् अरोगतां मदोषतां सुसाहितीं सुपुत्रतां समाहितायुरष्टभूति मभ्युपैति सोचिरा.
Thank you, sir. Ma'am, it's your time, ma'am. Welcome. Ma'am, unmute yourself. Unmute.
Good evening, very good evening, ladies and gentlemen. I extend my warm welcome to all who have already logged in here. So I would like to first and foremost welcome the orators of this evening, Dr. Subramani, who is the chairman of the Ethical Committee in Vaidehi Institute of Medical College. And I also welcome Dr. Ajit Huligor, who is going to be the orator for Dr. Authikeshavulu Memorial Oration, who is the Chief Transplant Surgeon at Nephrons. My warmest welcome to all the esteemed members of the Surgical Society of Bangalore, and my welcome to the State Chairman, Dr. Sopimat, the Secretary and the EC members, and also Dr. Devakar and the State Chairman-elect, Dr. Arvind Pachal. My warm welcome to the family members of Dr. Authikeshavulu. We have Dr. Jayarajan. Sir, welcome you.
Ma'am, unmute yourself, ma'am. It's getting mute.
I extend my warm welcome to the family members of Dr. Authikeshavulu. We have Dr. Jayarajan. Sir, welcome you, sir. Dr. Sharath and Mr. Balchandra, family members of Dr. Hanumaiah, we welcome you. And I also welcome all the past presidents and secretaries of the Surgical Society of Bangalore and the president-elect, Dr. Venkatachala. I welcome the GC members, Dr. Shivaram, and I welcome Dr. Rajan. My welcome will be incomplete if I do not welcome our advisors who have helped us through, who have guided us through. So my warmest welcome to Dr. Vasudev Rao, Dr. Lakshman, Dr. Chelani, Dr. Uday Mudebihal, and Dr. M.G. Bhatt. And of course, my warmest welcome to all the EC members and to Dr. Venkatesh and Dr. Manish and everyone. So my warm welcome to all the members. Let us sit back and listen to the orations delivered by the doyens. Thank you.
Thank you, ma'am. Can we have the introduction of Professor B. Hanumaiah, orator for today, by Dr. Shankarappa, sir? He is the plastic surgeon. He's my teacher also. Shankarappa, sir?
Welcome, Dr. Shankarappa, sir.
Namaste, madam.
Namaste, sir.
Namaste.
Start Madi, sir. Sir, heli, sir, introduction.
At the outset, I would like to thank Dr. Kalaivani, President of the Surgical Society, Bangalore branch, and office members for having given me an opportunity to introduce today's orator, Dr. S.A. of the oration, Professor B. Hanumaiah Memorial Oration 2020 today. Professor S.A. Subramani, former professor and HOD of Plastic Surgery, Karnataka Medical Service, born on 5/8/1943, to parents S. Armugam and Srimati Ranganayaki at Army Headquarters at Mudreddy Palya, Bangalore. Father served as a Subedar Major in Indian military service. He lost his father when he was 8 years old. He was brought up by elder sister Dhanmal and Indramani Bai. He is happily married to Dr. Premalata, former professor and HOD Human Development, VHD Home Science College, Bangalore, and also sees doctorate from Bangalore University. Professor blessed with 3 daughters and 5 grandchildren. Among the 3 daughters, one is at Switzerland, the other is at Melbourne, Australia. All are engineers. Education. He did his primary education at Appavu Pillai School and higher secondary education at Corporation High School, Shivajinagar, and pre-university education at St. Joseph's College, Bangalore. Later joined Central College and Bangalore Medical College for his medical training, and courses were done for MBBS, MS, MCH, and PhD in plastic surgery in the same college. He started his government service as a medical officer of of Health at Lakur PSC Malur Taluk Kola district at 1970 and retired from government service as a professor and head of the Department of Plastic Surgery at Mysore Medical College in 2001. He worked in ESI hospitals, KMC Hubli, Bangalore Medical College, Mysore Medical College in various capacities as lecturer, assistant professor, and professor and head of the department. After retirement from government service, he continued his service as a consultant in Sanjay Gandhi Institute of Trauma and Orthopedics, and later as professor and HOD at Plastic Surgery at Vaidhi Institute of Medical Sciences. He also served as honorary consultant plastic surgeon at National Institute of Speech and Hearing, Manas Gangotri, Mysore. At present, he is the chairman ethical committee, Vaidhi Institute of Medical Services. He has a PhD guide in the Rajiv Gandhi University of Health Sciences, consultant plastic surgeon at Agadi Hospital and Rudrapa ENT hospitals. Awards and achievements. He was awarded various awards and many achievements to his credit. First plastic surgeon to receive Hari Om Ashram Peritz Dr. S. Rangachari Research Endowment Award in ASI Conference at 2004. Professor Orations Sinha Award Best Published Research Article on the Indian Journal of Plastic Surgery 2007 on rare craniofacial cervical clefts. New original classification of craniofacial clefts published in Indian Journal of Plastic Surgery in 2005. He is the author of chapter on rare craniofacial clefts in the Indian Textbook of Plastic Surgery 2018. He has 76 national, international scientific presentations at his credit. He delivered guest lectures at Summer Scientific Meeting at Oxford University in 2011 and Maria Medical Center, Singapore in 2012 and Cleft Education Center at Edinburgh 2017. Professor delivered Dr. Authikeshavulu Oration at Vaidhi Institute of Medical Sciences 2015. Now over to Professor S.A. Subramani, the orator of prestigious Professor B. Hanumaiah Memorial Oration 2020 today. Thank you.
Sir, that was a great introduction of Subramani sir. Can we have Subramani sir, for your delivery of your oration? 30 minutes, sir.
Respected chairpersons, president, executive committee members of Surgical Society of Bangalore, senior teachers, ladies and gentlemen, my namaskars to everybody. I am expressing my sincere thanks to the executive committee members, president of Surgical Society of Bangalore for having given me this great chance as orator of my respected Professor B. Hanumaiah Memorial Oration 2020 today. Professor Hanumaiah sir was my MS PG student at Bowring and Lady Curzon Hospital, a great teacher and disciplined to the core. He hailed from a village, excellent academic career, FRCS Edinburgh in 1955. Joined government service in 1955, RMO at Victoria Hospital, rose up to the rank Director, PG Studies 1971, Senate and Academic Council member KPSC Selection Committee, started Nuclear Medicine Department at Bowring and Lady Curzon Hospital. He received Rajyosava Award in 1987. Now, my lecture and topic will be my 32 years experience in clinical and research aspects in plastic and reconstructive surgery. I'll be covering on the craniofacial congenital malformations, research work, reconstructive surgical facial and hand deformities in leprosy, major injuries of hand, upper limb, major trauma of lower limb, plastic reconstructive surgery and aesthetic surgery. This patient reported to me at Care Hospital, Mysore, with bilateral macrostomia at birth, front and side views. For this child, I did a multiple Z-plasty technique. Now he is 20 years, looking quite good. Another patient of congenital macrostomia, for this also reconstruction was done, followed up to 8 years. Another case of a bilateral craniofacial clefts, reconstruction was performed at Mysore Medical College. Then our plastic surgeon's main reconstructive surgery is cleft lip and palate. These are all the few pictures of cleft lip and palate before and after reconstruction. Now cleft frontal bone, this reconstruction with Calvarian bone graft through bicoronal approach. Then meningomyelocele, excision of the lesion, rotation, flap cover was performed. Giant nevus in this serial excision, and later on the area was primarily sutured. Now the research aspects. A new classification of craniofacial cervical clefts, anterior and posterior, which covers the entire clefts in head and neck regions. This was conducted under the guidance of my great Professor B. Sadashivamurthy. This classification is arrived on the proof obtained from the review of literatures of normal embryological developments of head and neck regions, abnormal embryological developments of clefts in head and neck regions, the reputed classifications of cleft lip, palate, and rare craniofacial clefts, the 4 bronchial cleft anomalies, the posterior cranial cranioschisis and cervical racheschisis clefts, the clinical cases of craniofacial and cervical clefts from reputed classifications, and from our series of more than 1,000 cases of various clefts in 30 years. In this classification, apart from the anterior craniofacial cervical cleft soft tissue, the 4 bronchial cleft anomalies and the posterior cranial cranioschisis and racheschisis cervical clefts are included. There are 15 numbers of locations of clefts in soft tissue clefts in head and neck regions, which run in radial directions, anti-clockwise on the right side, clockwise on the right side, extending from the peripheral region and all converging towards oral cavity. These 15 clefts are noted in 8 weeks embryonic. Then there are 11 numbers of skeletal craniofacial skeletal clefts in skeletal region in head and neck regions. All of them are running from peripheral regions and converging towards oral cavity. In this classification, the posterior cranial and cervical clefts are included. The posterior cranial clefts, cranioencephalocele, and cervical encephalocele are included. The posterior cranial and cervical clefts. The embryological proofs in keeping the oral cavity as the central point of reference in the anterior soft tissue clefts in skeletal cleft regions. The oral cavity stomodium becomes the central point during the development of frontonasal process, maxillary process, and the mandibular process. They all converging towards oral cavity as they develop. The 5 facial process showing the line of fusion of these processes. Then the facial clefts of oral and facial clefts are depicted in this picture. The thyroclassal tips extending from the cervical region to the oral cavity region. The new classification, based on the clinical cases of clefts in classification, other repeated rare craniofacial clefts, the oral cavity becomes the central point of reference. According to the American Association of Cleft Lip Palate Rehabilitation, all the clefts from the peripheral region, they are all converging towards oral cavity. In the German classifications and BK cadence classifications, clearly indicating the clefts are converging towards oral cavity. According to Kubicha's classification, the soft tissue and the skeletal clefts extending from the peripheral region, they are all converging towards oral cavity as they develop. Professor Tessier's classification is most popular classification, well accepted. According to this classification also, number 0 cleft and 9 extending from the peripheral region, they converging towards oral cavity. Same Tessier's classification, the bilateral soft tissue and skeletal clefts. Another unilateral cleft from Tessier's classification converging towards oral cavity. The basic reasons in keeping oral cavity as the central point of reference in 4 bronchial cleft anomalies which are included in this classification. The bronchial cleft anomalies include bronchogenic sinuses, cartilaginous rest, fistulae, and cervical cyst. There are 4 bronchial cleft anomalies. All these 4 bronchial cleft anomalies, external opening is in the anterior border of the sternocleidomastoid, whereas the internal opening of these clefts are in the tarsular sinus and near the palatopharyngeal arch. This is how all the 15 clefts of soft tissue clefts extending from the peripheral region, all of them are converging towards oral cavity, including the 4 bronchial cleft anomalies are shown in this picture. Similarly, these 15 clefts are shown in 8 weeks embryo also. As we see clearly how they are extending as they develop, all the 15 craniofacial and cervical soft tissue clefts are like that. From number 10, cranial region, whereas from 11, 12, 13, and 14 are from the cervical regions. There are 11 numbers of skeletal clefts which are converging from the peripheral region. All of them are also converging towards oral cavity in the cranial, skeletal, and cervical regions. I express my sincere thanks to our Professor C. Balakrishnan, Professor Paul Tessier, and Professor Kubuchai, who gave me the inspiration to arrive at this classification. Number 1, soft tissue cleft in the median 1/3 of the forehead, nose, and upper lip in the median craniofacial segment. Number 1, soft tissue cleft in the median 1/3 of the forehead region in the median craniofacial segment. Number 1, skeletal cleft in the median segment of the maxilla. Number 2, soft tissue cleft in the middle 1/3 of forehead, nose, and upper lip in the median craniofacial segment. Number 2, soft tissue cleft in the middle 1/3 of forehead, nose, upper lip, and in the median craniofacial segment. Number 2, skeletal cleft in the nasal bone and in the maxilla. Number 3, soft tissue cleft in the lateral 1/3 of the forehead, nose, and upper lip in the median craniofacial segment. Number 3, skeletal cleft in the maxilla. Number 4, 5, 6, 7, and 8 are occupying in the oblique craniofacial orbital segment and the face. There are number 5 clefts, 4, 5, 6, 7, and 8, which occupy in the oblique cranial bonius cleft, orbital rim segment, and the maxilla. Number 4, soft tissue cleft in the oblique forehead lateral canthal region to the nose and upper lip. Number 4, skeletal cleft in the nasal bone. Number 5, soft tissue cleft in the oblique forehead, medial 1/3 of the upper and lower eyelids, face, and upper lip. Number 5, skeletal cleft in the maxilla. Number 6, soft tissue cleft in the oblique forehead, middle 1/3 of the upper and lower eyelids, face, and upper lip. Number 6, soft tissue cleft in the oblique forehead, middle 1/3 of the lower eyelids, face, and upper lip. Number 6, skeletal cleft in the frontal bone. Number 7, soft tissue cleft oblique forehead region in the lateral 1/3 of the upper eyelid, right side. In this case, cleft lip palate is also seen. Number 7, soft tissue cleft in the lateral lower eyelid, face, upper lip, right side. Number 8, soft tissue cleft oblique forehead, lateral canthal region, face, and upper lip. Number 8, skeletal cleft in the lateral orbital rim. Number 9, soft tissue cleft in the temporoparietal region between eye and external ear, face, and upper lip. Number 9, soft tissue skeletal cleft in the temporal bone. Number 10, soft tissue cleft, macrostomia, auditory canal, external ear, and earlobe. All are included in number 10, soft tissue clefts. Number 10, soft tissue cleft, bilateral macrostomia. Number 10, skeletal cleft in the mandible. Number 10, soft tissue, bilateral macrostomia. Another case. Number 10, skeletal cleft, bilateral cleft in the mandible. Number 10, soft tissue and the skeletal cleft, bilateral macrostomia, and the skeletal cleft in the mandible on the right side. Number 11, soft tissue cleft, which is number first bronchial cleft anomaly. The external opening is at the angle of the mandible. Number 12, soft tissue cleft, the second bronchial cleft anomaly. The external opening is in the anterior border of the sternocleidomastoid muscle. Number 13, soft tissue cleft, which is third bronchial cleft anomaly. The external opening is in the anterior border of the sternocleidomastoid muscle. Number 14, soft tissue cleft, bilateral, fourth bronchial cleft anomaly. The external opening is near the sternoclavicular joint. Number 15, soft tissue cleft, which is in the median neck, in the lower lip. Even the tongue clefts are included in number 15, soft tissue clefts. Number 15, soft tissue cleft in the lower lip, sternal region. Number 15, skeletal cleft in the mandible. I must express my sincere thanks to our Professor C. Balakrishnan, who arrived at Nagapur classification. Now regarding the trauma, this is a case of a saddle nose, traumatic saddle nose, augmentation done with iliac bone graft. Another case of a saddle nose, traumatic, in this conchal graft was used as augmentation. Reconstruction of traumatic defect of nose by forehead flap. Reconstruction of nose defect by nasolabial flap. Reconstruction of loss of ear lobe by post-auricular flap. Reconstruction of scalp defect by transposition flap. Reconstruction of bony scalp defect by acrylic implant and scalp rotation flap. Reconstruction of alopecia of scalp by tissue expander and covering the alopecia region with hair-bearing area. Reconstruction of major facial-maxillary injury by debridement suturing to normal anatomical positions. Reconstruction of severe facial-maxillary injury with fracture of maxilla by reducing the fracture, fixation of plate and screws, and soft tissue suturing in normal anatomical positions. Reconstruction of incised injury of the face, debridement and suturing in normal positions, skin with subcuticular. This case followed from 2008 till 2020. Reconstruction of incised injury, face, debridement and meticulous suturing. Burns injury management in KR Hospital, Mysore, wherein we used to keep severe burn patients after giving good bath in oxygen tent and ventilators. Onco-reconstructive surgery. Reconstruction of carcinoma of scalp by trapezius flap. Reconstruction of carcinoma cheek by pectoralis major flap as a lining and deltopectoral flap as cover. Reconstruction of carcinoma cheek by free fibular graft. Reconstruction of dermatofibrosarcoma by pectoralis major myocutaneous flap. Carcinoma of maxilla, involvement of palate by forehead flap reconstruction. Reconstruction of basal cell carcinoma by glabellar forehead flap. Reconstruction of basal cell carcinoma by nasolabial flap. Reconstruction of basal cell carcinoma with cheek rotation flaps. Reconstruction of basal cell carcinoma with cheek rotation flap before and after. Reconstruction of basal cell carcinoma with bilobed flap technique. Reconstruction of carcinoma breast with latissimus dorsi myocutaneous island flap. Regarding reconstruction, we had a great pleasure, myself, Dr. Shekhar and Dr. Shankarappa, to work at Baroda from 1/1/2000 to 15/1/2000 in leprosy reconstruction surgery. And we had the great pleasure of working with great leprosy reconstructive surgeon, Dr. Srinivasan. Saddle nose, leprosy saddle nose reconstruction with conchal cartilage graft, preoperative and postoperative pictures. Another case of a saddle nose leprosy reconstructed with conchal cartilage graft, pre and postoperative pictures. Then claw hand, lasso technique was used, and we did number of cases by correcting claw hand, post-operative picture. Then foot drop, where the flexor tendons are brought anterior to the anterior compartment. This is the technique of Professor B. Srinivasan. Reconstruction of extensive injury of forearm with exposed vessel tendons and fractured bones by abdominal flap. How the abdominal flap was raised and insert was given, pre-operative and post-operative pictures. Trauma burns, reconstruction of post-burn contracture of axilla and elbow on the right side, contracture released and skin grafting was done. Then post-burn severe deformity of hand and fingers, reconstruction by Elizaro release technique, application of Elizaro rings after gradual distraction, we could be able to correct the deformities. Trauma of the reconstruction of injury of dorsum hand by anterolateral fasciocutaneous thigh flap. Then we used even many external fixators in contraction of the fingers, application of external fixators and grafting. This becomes rigid immobilization. After that, splint can be applied. Then wind blown hand, where the flexion contracture can be gradually distracted by many external fixators application. Trauma of lower limb, reconstruction of external injury with exposed fracture by cross leg flap. This was done in Hubli. Then this is the pre and post operative picture of the boy. Another case of a reconstruction of severe mangled right extremity of lower limb by cross leg flap. This was operated in Sanjay Gandhi Hospital. This is how the flap was inserted after division of the flap and pre-operative and post-operative pictures. Then reconstruction of the post-burn knee contracture by Elizaro gradual distraction technique. Application of, there was no surgery involved in the posterior aspect of the knee, so gradual distraction gives a good results. Another case of a reconstruction of post-burn contracture of the knee, Elizaro gradual distraction technique. Post-operative of the same boy. Then post-operative burns contracture of knee released by application of weight only and distraction. No surgery was performed in this case. Reconstruction of a sacral pressure sore by bilateral gluteal rotation flap. Reconstruction of the sacral pressure sore by unilateral gluteal rotation flap. Then for small breast augmentation mammoplasty with silicone implants, pre-operative and post-operative pictures. Small breast augmentation mammoplasty with silicone implants, we can see the silicone implant, pre-operative and post-operative pictures. Then reduction mammoplasty by superior medial medical technique, pre-operative. Then tummy tuck and mastopexy followed after 2 years. Then liposuction. Then another liposuction was performed. Then deviated nasal septum, nasal tip deformity, spreader graft was done in this case. Hymenoplasty using local flap technique. Then transsexual conversion from male to female. Then penile elastic implant. My great thanks to my great teacher in general surgery, Professor N.A. Narayan Swami sir, Dr. Bashir Ahmed, Dr. Ramaswamy sir, and my respects to my mentor in plastic surgery, Dr. V.A. Ram, Professor B. Sadashivamurthy, Dr. K. Shekhar, Professor Parangasadas, Dr. T.N. Vyasrao, Dr. Gurumurthy, and Dr. Shekhar sir. Thank you very much.
Thank you, sir.
Sir, you have finished well ahead, sir. This is the first time we are seeing a orator finishing ahead of his time. And you are ahead of your plastic surgery also, sir. You are the stalwart, we call doyen or something like that. Ma'am, you want to say something? Few words?
Yeah, really. I think Subramaniam sir has presented his experience. It's excellent. There are so many things which we are not aware also. And sir has done research in those fields. Really, sir, very great of you. Feel very proud that you are our faculty. Thank you, sir. Thank you so much.
Lakshman, sir, you want to say some few words before we go for the felicitation? Shashank, you can display sir's citation and the memento from Surgical Society.
Okay, sir.
Yeah. Lakshman sir, you want to speak? Any senior surgeons you want to speak on Subramani sir, Vasudeva sir? We have Rajan sir. We have few more minutes because sir has finished well ahead and he has covered all the things he has done. This is a citation. Okay, I think Shankarappa sir has covered all his postings, positions, where he worked. And okay, the Surgical Society thanks the Hanumaiah family. Ma'am, you want to say a few words about...
Yeah. Dr. I really thank the family members of Dr. Hanumaiah who are here with us. Dr. Sharath and Dr. Palachandra. The SSB is really grateful to you all to be present here. And as everyone knows, the orations are performed, orations are done on the last day of our continuing surgical education program. And because we had a CSCPs in the evening, we are having this the next day. CSCP was a very successful program, as Dr. Venkatesh was mentioning, and appreciated by the PG. So I'm really happy and thank you, Sir Subramaniam sir, once again on behalf of the Surgical Society.
Thank you very much, please.
We are missing all that glory. There is no Mysore Peta, the Turai, Shalu, all that. We are very sorry for that, sir. It's an online felicitation. We have all the senior faculty here. We are all blessed today.
I'm so much grateful to you all for conducting so nicely these online programs. I'm really thankful to you all.
So this citation and the memento will be delivered to you by one of us.
Thank you very much, please.
Yes, sir. Because of this corona, please excuse us.
Thank you. Thank you.
Rajan sir, please, few words.
Good evening, everybody. I must congratulate Professor Subramani for that extraordinary and good oration. I never knew behind that silent gentleman was so much research and original activity. And I'm very proud that he is a member of our society and delivered this oration today in his own quiet way. Congratulations, sir. I'm indeed very happy to be your friend and colleague. Thank you.
Dr. Sharat Chandra, sir, you want to say a few words? You can unmute yourself, sir. Yeah.
So thank you so much.
Yeah.
Thank you so much for inviting me, sir.
Yeah.
And I congratulate Dr. Subramani on a well-done oration, sir. And I also thank Dr. Lakshman and all the faculty members for having invited me, sir.
Yeah.
Thank you so much, sir.
Yeah,
thank you.
Sir. Vasudeva, sir, you want to say something?
Dr. Ashok Godhi sir is with us.
Yeah.
Yes,
Vasudeva, sir. Yeah.
No, I just want to add, apart from the accolades that's already given to Subramani for his excellent depiction of his work, very pictorial, and some of them are gory pictures. For medical faculty is fine, but for public viewing it may be a little gory. But some of the reconstruction that he has shown is really excellent. I must also at this juncture thank our good old friend Dr. Ashok Kumar, KV Ashok Kumar, who was actually instrumental in starting this oration in the name of Hanumaiah. Surgical Society owes him a lot because he has mobilized the funds along with the family members of Hanumaiah and from his own to start this oration, and which has been there with the society for a good many years. That's all I have to say.
Yeah. Thank you, sir. Thank you, sir. Can we go to the...
Yeah. Dr. Ashok Kumar sir also. So thank you so much, sir.
Yeah. So we'll go to Manish Joshi. Manish, are you there? Can you introduce our Professor M. Authikeshavulu orator? Ajit, sir? Yeah.
Is Dr. Ajit Hulgol with us? Sir?
Yes, sir. He is there. He is there. He's not there. Yeah.
Welcome, sir. Good evening to you.
Ajit, sir, welcome, sir.
Thank you.
Yeah.
It's my proud privilege to introduce the Professor Authikeshavulu orator for 2020, Dr. Ajit K. Hulgol. Dr. Ajit K. Hulgol is a man who wears and has worn many hats: pioneer kidney transplant surgeon, hypnotist, cricket commentator, and also a wildlife photographer, all thrown in one personality. He was in the team that did Karnataka's first successful kidney transplant in May 1983. Since then, in these 37 years, he has done almost 2,500 transplants, both in India and abroad, and specializes in doing multiple artery transplants and double ureter transplants. He started transplant program in several hospitals: MS Ramaiah Hospital, Wokhart, Yellamma Dasappa, Ashok Nursing Home, Columbia Asia Hospitals in Bangalore and Mysore, to name a few. He has also established transplant centers in Jalandhar in India and in Dhaka in Bangladesh. He has been a consultant for Nigeria, Uganda, Ethiopia, and other African countries. Dr. Hewell Gold was a cricket commentator in English for All India Radio from 1972 to 2005 and has been a commentator for Doordarshan for a few cricket matches, including some one-day internationals as well. An image that he has taken in the Nagarhole Tiger Reserve in Karnataka of a leopard descending vertically down a tree won him the coveted runner-up award in the highly prestigious BBC Wildlife Photographer of the Year award in 2009. He is also an associate of the Royal Photographic Society since 2008. Dr. Hewell Gold was given the title of Honorary Special Police Officer in the Karnataka Forest CID Wing for his courageous role in nabbing over 40 tiger and other rare animal poachers who were operating in the Nagarhole Tiger Reserve. Dr. Hewell Gold is married to Dr. Medha, anesthesiologist, and has two sons, both reputable lawyers in the Karnataka High Court, and is blessed with two grandchildren. After his resignation from Columbia Asia Hospitals in January this year, he is now leading a quiet, well-deserved retired life in Bangalore, managing his two farms, one in Bangalore and other on the banks of the Kabini River in Karpura. The President and the Executive Committee of the Surgical Society of Bangalore and the Association of Surgeons of India, Bangalore City Chapter, wish him all the success and happiness and are extremely happy to honor Dr. Ajit Hewell Gold on this day, 28th November 2020, for delivering the prestigious Professor M. Authikeshavulu Memorial Oration.
Thank you, Manish. I think that was a brief introduction. Hope Ajit sir will invite all the SSB members to his resort in Kabini.
Unfortunately, I don't have a resort there, but you're most welcome.
Okay, sir. Do we have the family of Authikeshavulu, sir?
Yeah,
Ma'am,
yeah,
do we have? Yeah.
Yeah, sir is there. Dr. Jairajan is there. Sir, we welcome you, sir. Dr. Jairajan, yeah, he's here. He's here with us.
Okay. Sir, Ajit sir, you can start your oration, sir. Yeah. Thank you, sir.
Now, look, I'm new to this presentation, so what do I do? I share the
sir,
screen now?
yes, sir, please. Lakshman sir, can you allow him to share his screen? Make him a co-host, sir. Lakshman sir? Ajit sir, now you are a co-host. You can share your screen, sir. You can.
Can I?
Yes, sir. Yeah.
Yes, sir.
I can. Okay.
Put it to the PPT, sir. Yeah.
Yeah, you can see that?
Yes, sir. Yes, sir.
Yeah, right.
Audio, video, everything is clear, sir. Yeah.
Good evening, everyone. President Dr. Kalyavani, Secretary Dr. Venkatesh, and all the members of the Surgical Society of Bangalore and the city chapter of the ASI. Before I start, I would also like to thank 4 people, especially, for nominating me to this award and for this huge honor, absolutely huge honor in making me the orator for this evening's function. This is one of the great events in the Surgical Society calendar for the year, and I'm truly grateful for all of you. And these 4 persons I'd like to especially mention, in no particular order, are MG Bhatt, with whom I share the same birth date, and we are also from Hospete, C.S. Rajan, Lakshman, who was my classmate in PUC National College in 1968, and H.V. Shivaram. These were 4 people who nominated, or at least were instrumental in nominating me, and thank you all very much. Now, I'd like to start by paying homage to the great man himself, Professor Authikeshavulu. He was, today, of course, Garvapsi is a rather bad term, but he was one of the original Garvapsis. Even though he studied abroad and then he practiced abroad, he came back to India and specifically to Karnataka and to Bangalore to impart and to pass on his knowledge and his surgical skills to a number of young surgeons who were very, very eager to learn from him. It is said that, we in our generation and future generations can see further ahead. You can see the horizon much, much better, mainly because we are standing on the shoulders of these giants. And this man was truly one of those great giants, and we owe a lot to Professor Authikeshavulu for being the giant that he was and for letting us stand on his shoulders to see much further. Another person I'd like to pay my, what's happening here? It's stuck. I don't know, for some reason, my screen is stuck. No idea why.
It's not moving, sir.
Yeah, okay. I got that. And I'd like to pay homage to my professor, Dr. RVS Yadav, who taught me transplant surgery, and I am what I am thanks to him. Coincidentally, he also shared the same birth date as me, and then we used to keep wishing one another and being the first in the morning to wish one another. So I miss him greatly because he died of complications of hepatitis C, unfortunately. And I miss a truly great friend and philosopher and guide. Now, before I go on, I'd like to say that, as the introducer said, I wear many hats. Yes, that's true. I need to, I'm so bald. I need to wear at least not one, but several hats. As a transplant surgeon as well. Now, I'm not trying to boast here, but I'd like to tell the younger surgeons here that, having been on the team that did the first successful transplant in Karnataka in 1983, I beg your pardon, and subsequently almost close to 2,500 transplants, by virtue of having been there in the first place and having done so many transplants, there are a number of firsts to my credit. I'm not saying that in a boastful manner. I'm just saying it because by virtue of having been there, like I said, I've seen so many firsts. Some of them are national firsts, some of them are international firsts, and so on. And my specialty, as he mentioned, multiple artery transplants and double ureters. And I've trained a number of surgeons both here and abroad as a transplant surgeon. Now, again, I don't know why I'm getting stuck here. It never did happen earlier. Can someone change the slide for me, or do I have to do it myself? Or can I be allowed to change the slide?
Sir, I think you have to, because you are sharing the screen.
Yeah, but I don't know why it's not moving.
It has to do with the slow connection, Ajit. Can you hear me? Yeah.
Yeah, I can hear you clearly. Absolutely.
If you want me to do it, I can do it for you. If you
I think if you can take over, I'll be grateful.
Stop sharing, Ajit. I will share my screen and show it to you.
Ajit, sir, close your screen, sir. Close your windows. Yeah.
Stop sharing. Yeah.
Stop sharing. Okay. Yeah. Stop sharing. Okay, I'll do that. Yes, I've done that.
Give me 30 seconds and I'll get going. Just give me 30 seconds.
Sure. Sorry about that, ladies and gentlemen. It worked beautifully, but I was rehearsing.
It happens, sir.
Yeah, it does.
Advantages of technology.
Yeah. No problem, sir.
We have your standby, sir. We have hyperlinked it also. We'll open it.
Yeah, but I added a few slides. I hope those will be added on as well. I'm not too sure that will be the case.
Yeah. That's why we get all the PPTs as a standby and we hyperlink it. It'll be in the cloud, sir.
Okay.
Lakshman sir has taught us the technology.
Okay.
Lakshman sir, is it opening?
Just hold on.
No problem.
Just hold on for a sec. Yeah, okay.
Dr. Ajit, if you can tell us how the first transplant went across, what was the struggles and what was the successes and what was the...
That was a very successful transplant, actually, even though it was done way back in May 1983 and with just 2 immunosuppressants. We had only azathioprine and steroids. There was no cyclosporin those days. And in spite of that, that transplant went off well. We had 2 surgeons from Bombay coming down to help us, both from Jaslok. I think one was Joshi and the other was Kamath. And they came down and helped us with the first 5 transplants. And then after that, we were on our own. We did 5 in 1983. I remember that. And yeah, all 5 went off well.
So your screen is ready. Which slide you want, sir? Yeah.
Yeah, the third one, please, from top.
The one or the next one?
Yeah, right. Can you go to the next one, please? And like I said, just by having, by virtue of having been there and then done that and been here for so long, I was the first to use cyclosporin in Karnataka, the first to use the oral cyclosporin capsule, Neoral in India, the first to use Basilicimab, which is a generic name for Similac in Karnataka, and so on and so forth. But I'd like to pay special attention to this. I don't know whether you can see my pointer. Right? Yeah, this is the first to do a double kidney transplant in Karnataka. Interesting story there. Now, we had a lady who was on dialysis with us for a long time, and she was admitted in Maria Hospital because she was quite sick. And we thought we were going to lose her unless she gets a transplant quickly. There was no available donor. And her husband was a retired professor of urology from Victoria Hospital, from Bangalore Medical College. A urologist, professor, retired. He had come to see his wife in Maria Hospital. And unfortunately, when he was in the hospital, he had a massive MI and had to be admitted. He was put on a ventilator. And soon we found out that he was brain dead. So we spoke to his son, and the son said, you can go ahead and remove the kidney. But looking at his history, he was a chronic smoker, had an MI, he was quite obese. So we decided that, one kidney may not be optimal enough. So we removed both his kidneys and put them into his wife. And the surgery went off uneventfully. And then she was discharged on the 5th or 6th post-operative day that we normally do. And then she did well. So that was the interesting thing about the double kidney transplant. I've done a number of multiple artery transplants, not just one artery, but 2, 3, and even 4 arteries, and double ureter transplants, which again is rather rare. And the first to do a transplant on a Jehovah's Witness. I'll come to that a little later in my presentation. Can I have the next one, please? Yeah. So just a few operative slides to show 2 arteries. That's the external iliac artery that you can see down there. And these are the 2 arteries that you can see. That's the main artery. And this is the accessory artery, the apopolar artery. Next one, please. Here are 2 veins. Normally, if one vein is small and the other vein is big, we can tie off the small vein. It doesn't really matter, unlike with the artery where you have to anastomose both the arteries. In case of the vein, you can tie them off, but these were 2 veins and they were both of similar caliber. So I anastomosed them into side to the inferior vena cava. That's the inferior vena cava down there. Yeah, next one, please. Double ureters. Now, ureter is considered to be the Achilles heel of kidney transplantation. Now, since most of us don't know what Achilles or who Achilles was, I would think the closest we can come to is Duryodhana's thigh of transplantation. Because, all of us know that Duryodhana's thigh was his weak spot. The ureteral implantation is the weak spot of kidney transplantation. That's the one that leaks. And it can leak much later, usually on the 4th or 5th post-operative day, and then it can have rather disastrous consequences. So normally, even a single ureter, you're a little nervous about doing even a single ureter reimplantation. But to have 2 ureters is something that most surgeons, almost all surgeons, will shy away from, and they will remove the kidney which has got a single ureter and not take the kidney with 2 ureters. But I always believe that we must leave behind in the donor the healthier kidney, the kidney with a single ureter, and remove the kidney with 2 ureters and then do that. So this was my technique. And the next one, please. As I said, this is the Duryodhana's thigh of transplant, the weak link in the weak spot in the transplantation. Next one, please. We presented this long back, 1994, our technique, and this is still being followed. Next one. And this particular patient, you can see that, he has 2 arteries, one artery there, another artery here, one vein here, another vein there. Lakshman is showing those 2 veins there. And again, because they had similar calibers, I had to anastomose both the veins. The person also had 2 ureters, and that's where the 2 ureters are, going down there. Yes, that's right. And he also had, coincidentally, he was married to 2 women, both living with him at the same time and very happy with each other. And he owned 2 pubs in Bangalore. And this is about, I think, more than 15 years ago. He came to see me recently. And after the surgery, of course, he did extremely well. He's still doing well. He invited us to one of these places, and we had a jolly good time there. I still remember that, even though it was about more than 15 years ago. The next one, please. Now, again, not trying to be boastful, but I'd like to tell the younger surgeons, yes, surgery is very, very important. You have to pay a lot of attention to your surgery, to your patient. You must do the best that you can. But for all young surgeons, I'd like to say, please develop a hobby. Become passionate about that hobby. Take it to the next level. Don't just dabble in it. And I was a cricket commentator when I was still doing my anatomy physiology in Bangalore Medical College. That was way back in 1972, and I was just 21 at that time, and probably was the youngest commentator in the country. Went on until 2005. And you'll notice at the bottom that I was chosen as one of the best commentators for 3 consecutive years in 72, 73, 73, 74, and 74, 75 by this very, very famous correspondent, Leslie Wilson, who used to write this column called Straight from the Shoulder in Deccan Herald. It would appear once a week. And at the end of the year, he would sum up what happened during the year. Can I go back again to that previous one? Yeah, and I've also given commentary for Doordarshan and notably Women's World Cup and the ODI. So what I'm trying to say is take your hobby to a next level so that you have something to fall back on. 2005, I quit doing commentary and was wondering what to do. And next one, I then picked up the camera, and it was an era of digital cameras. And so I picked it up in 2007. By 2008, I was admitted to the Royal Photographic Society, and those are the 4 letters, ARPS, after my name, which I'm very, very proud to wear after all my other degrees. And I was runner-up in the BBC Wildlife Photographer of the Year, and for this photograph. The next one, please. For this photograph of a leopard descending vertically down a tree, and you can see that the leopard is sharp, but the rest of it is blurred because it's what is called a vertical panning shot. The next one. Also, I mean, these I just dabbled in hypnosis and in acting as well. But the next one, I just come to my presentation now, it will start. And these, like I said, some of them were state-wise, path-breaking events, some national, some international. Next one. The first and the most important of these was this particular case. Now, this patient was on dialysis. He was the sole bread earner of the family. He had an aged mother who was diabetic. He had a brother who was 100% match as far as the kidney was concerned, but he was born deaf and dumb. There was no way we could explain to him or take consent from him. He didn't know what a kidney was. He didn't know what brother was or sister was or whatever it is. He had absolutely no idea. So there was no way we could explain to him and take an informed consent. Wondering what to do. How do we take this kidney out without informed consent? And that is, it's illegal. So we put it up on the international forum, nephrology forum and transplant forum, and a number of them, more than 90% wrote back saying, if the patient dies, all of them will die. So you must go ahead and do the transplant. But there were some who said that you'll be liable to, assault and battery and you'll be liable to criminal charges and so on. So there were some people who even accused us of being cowboys in the old Wild West, and you shouldn't do it. So with this dilemma, I went to the High Court, out of turn, wanted to meet the Chief Justice, Michael Saldanha at that time. I went to his chambers and I said, can I come and see you in private? He said, come in. I went and told him the whole story. He listened, and he was so taken up by it, he called the secretary, dictated the order immediately, right there in the evening after court hours. He put his stamp and said, go ahead and do the transplant. So next day we did the transplant. Next one, please. Next slide. And on the 11th of March, we were wondering what to do. That was in 1991. And I was, like I said, I was saying we don't have informed consent, meaningful, convincing consent. So what do we do? But with this High Court order, with the Chief Justice's order, I went ahead and did the transplant the next day. The next slide. Next one, please. But it was reported all over. The Lancet came out saying Indian organ donation goes ahead without consent. And the next one, the British Medical Journal saying doctors take kidney from patient incapable of giving consent. The next one, it made it to the legal and ethical aspects of organ transplantation, a textbook on this topic. And also in another textbook, next one, please. But there's a chapter on kidney transplants from young children and the mentally retarded. So it made it to that as well. So it made headline news. There was the fear that, this would open up the floodgates. Lots of donors would be declared, deaf and dumb, and kidneys would be taken from them. This was the slippery slope, and all sorts of things, idioms were used at that time. Fortunately, not even one transplant I can remember in the last 21 years have we done anywhere in India or anywhere else that I can recollect. where the kidney was taken from a mentally retarded person. Next one, please. Next thing was very interesting was Jehovah's Witness. This is what I was saying. I'll come to a little later. Now, Jehovah's Witness is a sect of Christianity that does not believe in blood transfusion or plasma or platelets or anything. No blood products can be given to them. I couldn't even take blood from the patient, keep it aside, and retransfuse if it became necessary. So used erythropoietin. The hemoglobin is only 6.5 when I operated. Fortunately, it went off well. But you know how the newspapers are. They interviewed me and I said, yes, this is a sect in Christianity. They don't believe in blood transfusions. So they said, what would you do if the patient started bleeding? And I'm supposed to have said, according to the newspaper report, I would have allowed the patient to bleed to death. I mean, this is absolutely ridiculous. There's no way that any surgeon is going to say, I'll allow the patient to bleed to death. Obviously, the patient wouldn't have bled to death, you know, would have tied the artery or whatever it is. But that's the way newspapers go around reporting things and putting words in people's mouths. The next one, please. This is another one, very, very interesting. A young 17-year-old boy, world-renowned young wildlife photographer on dialysis. He had Fabry's disease, extremely painful peripheries. He was rolling about in pain. He had to be dialyzed almost every day. In fact, his father wanted to donate, but the boy said no. But when it became very, very painful, he finally agreed. We did the investigation in the father and found that he had stones in the right kidney. Left kidney was fine. And like I said earlier, we leave behind the healthier kidney in the donor. We decided to take the right kidney. Normally, what I would do is I will send the donor for ESWL, for extracorporeal shockwave lithotripsy. But in this case, that would have set the surgery back by another 8 weeks at least, because of the edema and the adhesions that develop, it becomes difficult to remove the kidney. So we were not able to do that. The patient was sinking rapidly. So I said, let's remove the kidney and try and take the stones out outside, on the table, that is. So the next one, please. We removed the kidney, the right kidney, called my urology colleague over, and he put a ureteroscope inside. Next one, please. And this is where you'll see a short video on this, and that video will run now. And the ureteroscope being introduced inside. Just give a few seconds for the entire thing. It won't even take a minute or so. There is the scope going inside and checking into the various calyces, no stones here. So withdraw, going to another calyx and no stones there either. Then, withdraw and then go into other calyces, no stones. And no stones here either. But then we went and found stones in this particular calyx. But there was a membrane, you can see that membrane very, very clearly. That membrane was preventing, it's a congenital membrane. It was preventing the stones from coming out. So a laser had to be used. The membrane was burnt away. You can see these blasts from the laser, there it is. And once that membrane was burnt away, all the stones came tumbling out. You can see the stones just, look at them, just falling out rapidly, one after the other. And they were removed by basketing. And we went ahead and did the transplant. That was in 2015. The boy is doing extremely well, and so is the donor also, of course. And the boy is back to his wildlife photography. So that was an interesting case. The next one, please. The next was about ABO incompatibility. In those days, we were able to do transplants only from A to A and B to B. O was universal donor, AB was the universal recipient. Nowadays, of course, we can do across the blood barrier, but in those days, this is what we could do. But fortunately, at that time, we had one pair. The patient who was A, the donor, his wife was B. At that time, we had another pair where the patient was B and his wife, the donor, was A. So we decided that we would do a swap. This donor, second donor to the first patient, and the first donor to the second patient. Next one, please. So this is what we did. And of course, the newspapers wanted these details. This is not what we wanted to do, but newspapers went to town saying, this is an Ediga giving a transplant to a Brahmin, and a Brahmin lady giving a kidney to an Ediga, and so on. And they made, because that's what sells, those stories sell. The next one, please. And this came out in the paper saying, this sort of a transplant took place, and they did well, extremely well. The next one. This was again another first. That was in the same hospital, but it's not possible always to have a pair or two pairs in the same hospital. And fortunately, this time we had one pair in Suguna Hospital, and we had one pair in our hospital in Hebbal. And we decided that we would do the swap across hospitals. We did the donor and recipient in our in our hospital. They did their donor and recipient in their hospital in Suguna. And we transported the kidneys across by ambulance from one hospital to another. And then this was in 2018. All four are doing well. Both the donors, both the recipients are doing extremely well so far. Next slide, please. We did, at least before I was forced to resign earlier this year, we had done 17 ABO incompatible transplants. That is across the blood barrier and using various combinations and techniques. And all 17, touch wood, all 17 are doing extremely well. Even though there is a higher risk of rejection in ABO incompatible, all of them did extremely well. Next one, please. And all that surgery is to convert something from like this, something like this, dry one, to the next one. Not just this, next one. Not just this either, but the next one. Always aim high in life. That has been my motto, and that's what the motto should be. But when you do surgeries like these, and the next slide, please, and patients go on to win lots of medals in the transplant games that are conducted all over in the country, and the transplant Olympics, which are conducted just exactly like the International Olympics. They bring back so many medals. It's really worthwhile doing, going the extra mile to do these transplants. The next one. Young girl has grown up now. She was a very, very small girl when I did the transplant. The next one, superintendent from Nigeria, from Lagos. The next one was a girl who got married, migrated to Australia, and then she delivered twins, and she's doing well. The next one, please. And this I have the permission of Dr. Arjun Srivatsa, who's one of the leading neurosurgeons in Bangalore. He went on to win the gold medal at the International Olympics, Transplant Olympics in golf, and he got this gold medal. Next one, please. Yeah, that's the gold medal he's trying to chew off. The next one. Recent innovations in Karnataka, but not necessarily my own, have been robotic surgery. And I got this from Ballal just this morning, Sudarshan Ballal, 14 done in Manipal Hospital so far. And the next one, donor kidney retrieval through the vagina. This was done I think it was in Johns Hopkins. One has been done in Manipal Hospital so far. Obviously, you can't do that in a virgin. You have to. She has to be a lady who's delivered and who has healthy babies. Only then can you sort of violate the vagina and then go and remove the kidney. And obviously, only a female donor can take part in this. The next one, and there's also been the next slide, please. Also been a vaginal insertion of kidney and laparoscopic kidney transplant, and lots of things can be done, I guess. The next one, the future. Lots of things have been tried, all of them so far in the experimental stage, but who knows which one can sort of leapfrog and become the most innovative or most successful of all these. One is cloning, the next one. Kidneys from stem cells, the next one, please. These are small stem cell kidneys, the next one, please. So that's from stem cells. Cell therapy could replace the need for kidney transplants, is what is being carried out in some places. Next one. Again, research into 3D printing of kidneys. The next one, please. And it's believed that the next one, please. Within the next 10 years, fully functional bioprinted human organs could become a reality. That is the prediction. Who knows? The next one, please. But kidney plantation, no, not really. But I brought this slide up because one of the chief ministers of the time, Karnataka chief ministers, he was called to inaugurate a dialysis and transplant center. And instead of saying transplantation, he went on talking about, we must encourage kidney plantation. The whole talk was about kidney plantation. And I hope this is not what he meant by kidney plantation. No, I don't think so. Next slide, please. Xenotransplant. This is the one that can be done even tomorrow itself, where you can take organs from different species and put them in. The only fear is, who knows what new virus or new bacteria could be released and could be transmitted from one person to another. Technically, obviously, it's possible, we'll need higher immunosuppression. So unless I think there are improvements in immunosuppression, or until the bioengineered pigs become a reality, which again research work is going on in that could become a reality as well. Next slide, please. Next one, please. Just a brief thing about the situation in India. We have about 300,000 to 400,000 people developing chronic kidney failure every year in India. We do only about 4,500 to 6,500 transplants per year in India. That's all. The US, with 1/3 our population, does about 25,000 kidney transplants. So we should be doing at least 75,000. Again, that will be just a drop in the ocean, but still, 4,500 to 6,500 transplants is an absolute, it's pathetic, actually. We also have a scary situation of more than 60 million diabetics, and 1/3 of them will go on to develop kidney failure in the next 10 to 15 years. That is scary. Next one, please. Main cause, of course, diabetes and so on, but I won't go into that. The next one, please. Pressure. I'm asked about, are there lots of pressure when you're operating on VIPs, on politicians and so on? And I'm reminded of this statement by Keith Miller. Now, Keith Miller was one of Australia's greatest all-rounders in the 1940s, late 40s and 50s. He played under Don Bradman and then went on to play under Lindsay Hassett, the subsequent captain. He was a Royal Australian Air Force pilot, fighter pilot. He took part in the Second World War. He did sorties over Germany, dropped bombs in Germany, and then came back successful. And he was asked about pressures in test cricket. And he said, what pressures are you talking about? When you have a German airplane behind you, when you're flying, that is real pressure. And the way he put it was typical Australian. Real pressure is when you're flying a Mosquito. Mosquito is that is a British aircraft, small little aircraft, a metal frame, but wooden planks made of wood, a plane made of wood taking part in the Second World War. And you have this Messerschmitt, which is a German aircraft behind you. So he says real pressure is when you're flying a Mosquito with a Messerschmitt up your ass. That is Keith Miller, of course, the typical Australian way of putting it. That is real pressure, not test cricket, and certainly not, shouldn't be transplant. So from a clinical exercise of last resort, transplantation has become a vast industry-driven enterprise involving the replacement of many vital body parts, whose relative scarcity is engendering increasing fierce competition among hospitals, among transplant programs, among pharmaceutical companies, among physicians, and among the patients themselves. Next one, please. So from the world's first transplant surgeon who did a transplant from the elephant to his own son, the world's first pediatric transplant, it is also the world's first xenotransplant from a different species altogether. We haven't yet reached that stage yet. From that, the modern surgeon has become something like this. The next slide, please. Modern surgeon is like vultures waiting for a person to die so that, he says, I want the heart, I want the kidney, I want the brain, I want the liver, I want the pancreas, and so on. That's the modern, unfortunately, the modern transplant surgeon, the modern hospitals, the modern pharmaceutical industries, and so on. Thank you very much.
Ajit sir, that was very, very, very great. You showed us surgery is not only the life. You are a multi-talented person, and we should have some passion. Apart from surgery, we should try to develop our own habits and how to, show our inner interest. Thank you, sir.
Thank you. Thank you for having me here.
Yes, sir. It's our privilege and pleasure, sir. Ma'am, yeah.
Dr. Ajit sir, I think it was a privilege to have you on our Orations Day, sir. And I don't think we could have had a better oration. You have been so inspiring. I think this should be a lesson and an inspiration to all the young surgeons to not just get lost in the surgical world. And we must get into our personal hobbies, and we have to work towards it. I hope this lockdown gave some people a little bit of time for them to get into their hobbies. Well, even I did a little bit of painting. I just started. And sir, you're so inspiring. I think I should be doing more now. And it should be, even for the young surgeons, they have to come out with all the talents. And the moment we join MBBS, we're all buried into the books, and we think that's the end of life. I think, sir, you must give more inspiring talks to the younger generation, maybe to the students of medical colleges. I will request you to do that, sir. And you're so versatile.
I certainly will come forward. Once this COVID thing is over, I'd personally like to come and then give a talk, a real talk rather than a virtual talk like this.
Really, sir. Really.
So the younger surgeons, you must spend time smelling the roses, smelling the grass, going out and seeing a sunrise, seeing a sunset with your family members, with loved ones and so on, and enjoy nature. There's nothing more pleasurable than that.
Absolutely, sir. Absolutely. It's so inspiring. Well, that's really grateful to you, sir. My heartfelt thanks from the on behalf of the Surgical Society of Bangalore. Really a big thank you to you, sir.
Thank you.
Sir, it's a small memento and a citation. It will be delivered to you. Sorry again for that. We are missing all that.
Well, this is good to hang
felicitation.
very, very prominently in my house, in the real prominent place. That everyone who comes home, just like when a foreign dignitary comes, he's taken to Mahatma Gandhi Memorial. Like that, I'm going to bring all my friends first, look at this, and then go inside.
And you've done such challenging and daring surgeries, sir. Really great. Really great. Very inspiring, sir.
Can we have some of the senior faculty? Chalani sir, you want to speak about Ajit sir? Chalani sir, unmute.
Good evening.
Yes, sir.
Hey, hi.
Good evening. Congratulations, Dr. Ajit.
Hey, thank you. Wonderful to see you.
Excellent oration we have seen in recent times. Very good. And he's my old friend. We were together many hospitals. We worked together. Dr. Ajit and Dr. Mehta. Very, very nice and excellent oration. Congratulations and thank you very much for joining the Surgical Society. Of course, you are a member, but long time you are not coming.
Hopefully I was secretary for 2 years.
I know, sir. That's what I'm telling. You were active before. Nowadays you are not. So you must come and do something, as our president was telling. You must come and give your lecture to young generation, especially PG students, and for inspiring them. Please
I remember those days, Dr. Chalani, you will remember too. The Surgical Society of Bangalore and the city chapter were two different organizations with different presidents and secretaries and so on. And at that time, we were trying to bring the two together.
Yeah, we brought it together.
I'm so glad that it is now one body with just one common goal. It's lovely.
Ajit sir, when your name came for the oration, you mentioned only the 4 people, but in the EC, everybody was proposing your name. You are unanimous.
Oh my goodness.
Yes, sir. All the senior faculty in the EC.
I apologize to all the others.
Including Chalani.
Including Chalani, Rajan sir, Lakshman sir, everybody proposed, sir. Ravi Shankar sir.
Yeah. I had the privilege and pleasure of working with Dr. Ajit. And fantastic lecture, sir. Thank you very much. It was real pleasure to listen to you. I was a registrar with him at Malya Hospital when the transplantation program was going on. He was a larger than life, very gregarious and extremely, passionate, but also very friendly to the juniors. And I also remember very fondly, because I was not taking any remuneration from the transplant team, they were very large-hearted. And when I was about to go to England, they very kindly hosted a party for me and paid for my air ticket. So I remember that for the rest of my life. And I think Dr. Ajit was chiefly responsible for that. And he has many,
Thank you so much for mentioning
many facets to his character. And I remember him very fondly. Fantastic lecture, sir.
Sir, we have Ashok Godhi, sir. You want to say something? Ashok Godhi, sir, unmute yourself. We have Rajgopal Chennai, sir. Sir, yana matadtira? Chennai, sir.
We have Dr. Jayarajan also.
Yeah, Jayarajan, sir. Yeah, please give your feedback.
Dr. Authikeshavulu's family member.
Yeah.
Sir,
we have Jayarajan, sir.
Jayarajan?
Please unmute yourself. Yeah. Godhi sir, matadtira?
Hello.
Yes, sir. Yes, sir.
Hello. Am I audible?
Yes, sir. Yes, sir. Audible. Yeah.
You are.
Yeah. This has been an extraordinary oration, I should say, and really original work, and so much inspiring to the younger surgeons, and a very multifaceted personality. Apart from surgical dexterity that he has, he has excelled in several other fields also. And it's extremely wonderful lecture I have heard in the recent times. Extraordinary lecture. I must congratulate Dr. Huyilgold from my base of my heart, from the bottom of my heart. Thank you very much.
Thank you. Thank you so much.
Thank you, sir. Thank you.
Vasudeva sir, Shiram sir, Rajan sir, you want to speak something or we'll go to the next agenda?
Dr. Lakshman sir also.
Vasudeva sir.
Nothing much to add. It's already been, appreciated by many. My only association with Ajit was that I don't know whether he remembers those days in the 80s or 90s, early 90s when I came back. I came to know that when very good friend and junior colleague of mine in medical school was his colleague in a transplant program, that is Shankar Sundar.
Yes.
They were the first one to start in a small place in Lakeside Nursing Home. I remember that.
Yeah.
When many of the patients from our own state were to go to Bombay for a transplant, that also half of them would come back with a failed transplant those days. I remember that. And one or two of the VIP patients actually had gone to Bombay, had a couple of transplants done and didn't succeed. So there was no real transplant program actually going on in the 90s, in the 80s and 90s in the state of Karnataka. And, thanks to these two heroes who started this program amongst all the adversaries with the very limited resources, not bothered about the outcome, they said they went ahead and started this program. I must really congratulate the team for having started this program and giving such an inspiration to all the younger generation to come. And the transplant program really took off. And now with Karnataka is one of the leading states in terms of conducting the transplant, not only in kidney, but also of the many other organs in many of the states. Of course, Ajit's barrier, the interest has already been alluded to. Only thing he didn't do was he didn't conduct a transplant program in the wildlife. Maybe he should seriously think of doing that in his retired life.
Veterinary doctors will put a case, sir.
When I was training in PGI Chandigarh, we had to operate on dogs. So we had to catch street dogs. I had to be the anesthetist and the surgeon myself. And we would auto transplant, remove one kidney, do an auto transplant of the other kidney. And if the dog survives and passes urine, you know it's a success. If the dog dies, either I've given too much anesthesia or the kidney has failed. So we had to open up the dog again and see whether the kidney is all right or not. So I did do in dogs, but not out.
Ajit sir, thanks a lot.
Thank you very much, Ajit. Thank you.
Please acknowledge our memento on citation. It will be delivered to you, sir, by one of us. Thank you, sir.
Thank you, sir.
I think we had very good orations, very precise, concise. I think, shall we have feedback of students about the CSEP? Can I call Bhavana? Bhavana Chinmayi, are you there? Unmute yourself, ma. Bhavana?
Yes, sir.
Yeah, please.
Good evening to one and all present here. On behalf of all the PGs who have attended the CSEP, I would like to say a big thank you to the organizing committee of Surgical Society of Bangalore for organizing such a huge program. And I am Dr. Bhavna from KIMS Bangalore. And as an exam going PG, I cannot begin to explain how important this entire program has been. All the case discussions, the cases were discussed adequately, whether it was history, examination, investigations, or management. And more than that, the simultaneously the chat sessions that were happening was a really good exposure for us. For all the basic doubts that each of us had could be asked on the chat sessions, and they were being patiently answered by all the senior surgeons. And moreover, I would like to say that during these COVID times, as finally a PG, we've actually missed out on a lot of surgical exposure or clinical exposure. And this has been a wonderful platform for us to have discussions with senior surgeons and to know all the basic things, small doubts, and tips from all the senior faculty members. Then there were these faculty papers that gave us a wonderful insight on the recent advances. And then there was the sessions on stomas and tubes by Arun Kumar sir, thoracic tips and truths by Rajan sir, and radiology by Sudhir sir, and surgical specimens by Alva sir. all the notes that we prepared during this entire session are going to be invaluable for us for our examinations. Kalaivani ma'am, I was your student. I thank you for giving me an opportunity to express my gratitude for this entire program. I have to say that it is really commendable for all the efforts that must have gone into organizing such a big conference on a virtual platform with such good time management. On behalf of all the postgraduates, I give my sincere thanks to everyone. Thank you.
Thank you, Bhavna. Hope that was a frank one.
It
You didn't
definitely
give
was,
me any
sir.
negative feedback, so we want to improvise ourselves actually. It's okay.
Thanks,
Shashank?
Bhavana. That was very nice of you, and wish you all the best for your future endeavors. Okay?
Thank you. Thank
I
you
think
so much.
all these proceedings and the presentations are available, ma. I think
Yes,
it's
sir.
been shared in the groups. Please talk to your faculty. They'll give the proceedings, and
Sure, sir.
you can share with your
That would
friends.
be really helpful, sir. Thank you, sir.
Shashank from Shashank, can you give your feedback?
Yes, sir. Good evening, respected faculty. Thank you for providing me an opportunity to share my views about this prestigious Professor Hanumaiah Memorial Oration and CSEP. Coming to case discussions, it was really very useful. It was complete. And as told earlier, during this COVID era, we had lack of clinical exposure, surgical exposure. But I think we have covered all cases in this in a span of 1 week, all short cases and long cases. And many questions asked by senior faculty for examiners. And this was literally a preparatory exam for all of us who could get all the questions and prepare further for our final examination. And coming to the quiz, it was an amazing experience. The preliminary round was also very good, including all the rounds of finals. I thank all the faculty, Rajan sir, everyone who made the quiz a very interesting thing. And one thing I would request is, can we get the answers for the preliminary quiz and the PPT of finals if we could get? It would be useful to us, sir.
We will mail you. We'll mail you.
I can mail it to you.
Yes.
Yes, sir. Thank you, sir. And
Shashank, it's already available.
Yes, sir.
You have to answer the quiz, the preliminary quiz, and you will get the answer sheet with your own score. It is already available.
Okay, sir.
All right.
And radiology and pathology specimens were also very useful. And thank you everyone for organizing such a wonderful event for all of us, for all the postgraduates. Thank you one and all.
Thank you, Shashank. Okay, please give your feedback, man. Hope tell other your friends to give the feedback to the Google Forms.
Sure. Yeah, the feedback forms, please.
Yeah. So don't don't leave the group. I'll say vote of thanks. Then there's a national anthem. We have to stand. Then we can adjourn for today. So I'd like to thank Ravi Shankar sir. That was the beautiful invocation. Really, the God has graced us with the non-stop CSEP and the good orations going. Thank the President ma'am. I think she has not slept for the whole 1 week or whole 1 or 2 months. She has talked to each of the faculty. I saw 130 faculty. I don't know how she coordinated with all of them. It's her brainchild. The CSEP went on very well. Thanks Shankrappa sir for introducing Subramani sir, the doyen of plastic surgery. Subramani sir, your oration was just great. We are privileged to have you with us. Then Manish, thanks for introducing Ajit sir. And Ajit sir showed us we should try our passion in all the extracurricular. Surgery is not only life, try extracurricular and keep ourselves. It should not be a pain, it should be a pleasure to work. Thanks for his oration and transplantations. I thank the advisors, the EC members, the SSB members, the students for their active participation, especially the case presenters who came very well prepared, the internal and external faculty, Thiru from Zydus for his technical support, the Glenn and Kumar for they are always with us in the office, the CSEP team, especially Lakshman sir, Nishant, Niranjan, Suhas, Naidu, Sunil, Manju. There is plenty of it's unending story. It's all because of the teamwork. We did this great job. Thank you all. Shashank, can you play the national anthem?
Venkatesh, we have to thank the students.
Yeah, I have thanked the students, ma'am.
Yeah, overwhelming response from them. We got 50 PPTs and we had to shortlist from them.
Yes, ma'am.
So thanks to the students.
I've said, ma'am. I've said.
Thank you, Dr. Venkatesh. Thank you so much.
Hey, nothing, ma'am. It's my job. Thanks for giving me an opportunity of Secretary of Surgical Society.
Not me, the SSB, right?
Yeah, we'll stand for the national anthem, then we can leave the meeting. Yes. Please stand.
Thank one and all. Bharat Bhagya Vidhata Samyog Sindhu Dravida Utkala Ganga Vindhya Himachal Yamuna
Uttala Jalataranga Tava Shubha Name Bhage Tava Shubha Asis Mange Gaye Tab Jagata Gana Mangala Dayak Jaya He
Bharat
Bhagya Vidhata
Jaya
Jaya He Jaya He Jaya 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 Jaya
Thank you all once again. Shashank, close mado in picture akutiyamla.
Thank each and every one of you.
Yeah.
Okay, thank you. Thank you,
Madam will
President.
host a big party.
Madam,
Sure,
Madam, party is due from Madam and Venkatesh both.
Definitely, sir.
If all are willing, we'll have, sir, on the EC day itself.
With unlimited daru,
EC
sir.
day, no, when we will be having this AGM.
Okay.
AGM, sir.
But yeah, I will end the meeting with your